To parents or people who have not experienced eczema before, often they consider eczema as something trivial, something simple and skin deep. But trust me, eczema is beyond skin deep. The inflammation, infection and itchiness might cause not just physical but as well as psychosocial, mental, as well as the personality disorder among the kids, especially among the teenager. So bear in mind that eczema is beyond skin deep. Among the physical complications, the most common one among atopic eczema patients is secondary infections. And among the infection, bacteria being the most common, fungal is being the most confusing, and the virus called herpes simplex is the most dangerous and urgent, whereas another one called human pox virus is the most disturbing one in terms of cosmetic presentation. Let us take a look at the most common first, the bacterial skin infection. For example, if initially the eczema is red, dry, but suddenly from dry become wispy, the water that oozes out from clear become turbid. Initially it's itchy, now it's painful, it's expanding and not responded to your usual 1, 2, 3. Usual 1, 2, 3 means normally if you have a bit of redness, you remove the sweat, apply moisturizer, apply a bit of steroid, tacrolimus or pimecrolimus. Often they resolve or slowly improve in the next 3 to 7 days infection. In this case, you need to apply either topical antibiotic, it's a wide area, then you need to take oral antibiotic together with the anti-eczema medication. Second, not say most common, but most confusing one is the fungal infection. Fungal infection and the dry eczema, they look alike, sounds alike. Both conditions, they are dry, they are scaly, they are redness and itchiness. This fungal infection have a well-defined margin, and if you photo to take now, 2 weeks and 4 weeks, the lesion ripple out slowly over the next few weeks to months. Right? So when you have a slowly expanding margin, not responsive to your usual 1, 2, 3, and thirdly is asymmetry between the left and the right. In that case, think about fungal plus eczema. And the third one is the most urgent, most dangerous that require urgent admission or systemic antiviral, which is the Eczema Herbacum. Often they present to the clinic with high-grade fever, poor oral intake, very lethargic, toxic, and the lesion. There are multiple chickenpox-like blisters, rapidly appearing ruptures and correlates to each other. In this case, you need to cover the child with oral or injectable antiviral, namely acyclovir. And the last type of common infection among eczema patients is the Molluscum contagiosum. It's due to a human pox virus, appear as a little white color lump and bumps, and over the next couple of weeks they become a bigger pearly white papule. At the center of the papules there's an umbilicus, we call it umbilicated papules, and some people call this 𝗘𝗰𝗇𝗃 nasi, 𝗘𝗰𝗇𝗃 lembut, 𝗘𝗰𝗇𝗃 anggur, and etc. And this one you need to use different method to remove it. Although it's not dangerous, but it's disturbing and it's transferred from one part of the body to other part of the body via scratching. So it's not easy to control that because scratching is one of the very common association among atopic eczema patients. And besides the physical complication, the atopic eczema patient also tends to develop psychosocial and mental disorder because of the chronic itch, scratching activity. The child could not sleep at night properly, and the next day they can't perform well either in the school, at work. And if this chronic itch cycle become a long-standing problem, they start to develop anxiety, depression, low self-confidence, as well as other personality disorder like attention deficit disorder. So bear in mind, atopic eczema is beyond skin deep, and the inflammation will compromise the skin barrier and with frequent infection. Management atopic eczema is controlled well so that the inflammation is truly in remission and the skin can be repaired slowly over time. So don't use this watch and see and say eczema is self-limiting. You just wait for the natural immunity to overcome the eczema. And this does not work in atopic eczema because atopic eczema is an intensely itchy, frequent infection skin condition.